So the next disease is goiter, which is an enlargement of the thyroid gland, and it is classified into diffuse goiter, solitary nodular goiter, multinodular goiter. So in the diffuse goiter, there is a generalized hyperplasia of the thyroid gland, which can either be non-toxic or toxic. Solitary nodular goiter, where the enlargement of a single region happens to form lumps. Multinodular is where multiple regions form enlarged lumps. So, diffuse non-toxic goiter is a condition of compensatory hypertrophy and hyperplasia due to a decrease in T3 and T4. There is neither hypo or hyperthyroidism. Causes are physiological goiter, dietary iron deficiency, dietary goiterous agents like cabbage, turnip, usually the cruciferous vegetables, calcium, chloride, thiouridazole, and the cause can also be hereditary. And also, Graves' disease might develop into a later stage of diffuse non-toxic goiter. And rarer are the causes like lymphoma or thyroditis. Treatment option is if it is a very small goiter, no treatment is required, just give iron support. And if it is large, you can either go for a partial or a total thyroidectomy where the thyroid will be removed. So, solitary thyroid nodule is found in 5% of this population, and 50% will have a large nodule, whereas 50% will have a true solitary nodule. Like in the earlier case, we said about multinodular goiter, the diagnosis has to be clear whether your nodule is a large nodule in a multinodular goiter or whether it is a true solitary goiter, nodule. And 80% is usually adenomas, 10% it could be a carcinoma, again 10% it could be a cyst, a fibrosis, or a thyroditis. Treatment that is used if it is a colloid cyst, no treatment is required. Simple cyst, smaller in size, less than 4 centimeter, again no treatment is required. Larger in size, that is more than 4 centimeter, you have to go for a lobectomy. Follicular cells, again you have to go for a lobectomy or a thyroidectomy. And if it is papillary carcinoma, you have to go for a total thyroidectomy. Next is multinodular goiter, which which is caused by progression from simple goiter. It could be sporadic, or it could be because of previous irradiation to the neck. Clinically, it presents as irritating cough, discomfort, dysphagia, and hyperthyroidism. Treatment is medical supplementation with thyroxine or surgery leading to total or near total thyroidectomy. Next is the Hashimoto's thyroiditis. This is an autoimmune disorder and the most common cause of hyperthyroidism, where there is an immune reaction against the self-thyroid gland leading to inflammation of the gland. This is actually called as thyroditis. Itis stands for inflammation, and whatever name it is added to, it is inflammation of that tissue. So, because it is thyroiditis, itis indicates inflammation of the thyroid gland. T cell mediated inflammation can also result in Hashimoto's thyroiditis. Causes are unknown, could be hereditary, and it's 10 times more common in women than in men. And there will be maybe a reason could be the presence of antibody against thyroperoxidase and thyroglobulin. So this figure explains how the whole system happens. Like an environmental trigger will activate the antigen presenting cells, which infiltrates into the thyroid glands. And in the initial stage, the thyroid cell will have antigens, and the presentation of thyroid specific antigens by post-insulted thyrocytes to antigen-presenting cells and processing these antigens by the antigen-presenting cells so that there is infiltration, accumulation, and clonal expansion in the cells, leading to antibody production and the breakdown of immune tolerance. The antibody production finally triggers the Th1 response, leading to cytotoxicity and cytokine production. B cells are also activated, and in this case, the B cells will be autoreactive, so that antibody producing plasma cells are also activated, and the Th1 response and the antibody mediated cell response will lead to apoptosis and ultimately cause hypothyroidism. So these are the different signs and symptoms in Hashimoto's thyroiditis: fatigue, depression, modest weight gain, food intolerance, excessive sleepiness, dry coarse hair, constipation, dry skin, muscle cramps, increased cholesterol levels, decreased concentration, that is, you are not able to concentrate on something. You have vague aches and pains throughout your body, and there will be swelling of the legs. You cannot call it as edema, but it's a swelling. If you have severe hypothyroidism, there will be puffiness around your eyes, slow heart rate, decreased body temperature, heart failure, and even myxedemic coma. Diagnosis is through TSH, where you have an elevated TSH and the presence of anti-TPO or thyroperoxidase antibodies. Treatment, there is no treatment as of now because it's an autoimmune disorder, and it can be managed with using thyroid hormone supplementation but requires continuous monitoring.